Well, in Summit Rounds this morning, we talked about concerns that patients have after surgery, and Alex here did the rounds. It was a common consent that Alex should be presenting more often in morning rounds. But just take a minute and tell us about your background. Maybe people know, maybe they don't know. How did you end up working with us here? And what did you do before?
Yeah, so before I got to work with the Summit Group, I was fortunate enough to have a career in athletic training. I was heavily involved in sports medicine, taking care of athletes at the Division I level down at Brigham Young University. I had a great experience with that, and then eventually made a transition in life, went to PA school, and then through another amazing opportunity got to know the group here with Summit, and have joined here about 3 years ago.
Mm-hmm. How do you think the experience in athletic training has impacted the way that you care for patients in neurosurgery?
It was very relatable having worked with them, because in that scenario, my role was not necessarily to provide all of the care, but to really quarterback or manage the case. So we had physicians involved, we had their strength and conditioning coaches involved, administrators, the educators, because they're student athletes. And so we get to be their liaison and coordinate their care and make sure they're getting to the right places with the right people at the right time, which is a little bit similar scenario to what we do now as advanced practitioners. Is I'm not the one performing the surgery. That's what you get to do, and that's your expertise. And so I get to help kind of be their liaison in the clinic, manage their care and make sure it's been appropriate, and really look out for their best interests and make sure they get to where they need to be at the right time.
So that's why you're so naturally good at it.
I hope so, yeah. Hopefully it's going okay.
It's been great.
Yeah.
It's amazing. And I can't believe it's been 3 years.
I know, yeah. Coming up this fall, it'll be 3 years. Mm-hmm.
So in your preparation for rounds this morning, and in your 3 years working at Summit and working with neurosurgical patients, and especially patients that have undergone surgery, what are the most common concerns that patients have about the period after their surgery?
It's a lot of unknown. People have not gone through this before. And a common topic that's come up, conversation, is really their only reference point is a friend or a neighbor, or maybe even something they've read about on the internet. And it's really not a very reliable source, because it is very unique. Everybody's going to have a different experience, so they just don't have a frame of reference as far as what to expect. So after having undergone the surgery, and maybe it doesn't line up with exactly what they expected, for better or for worse, and then it really starts the anxiety turning of maybe I'm unique, or I'm different, or maybe there was a problem, and then it just creates a cascade of fear and avoidance of movement. And it can really escalate from there. So it's hard to manage those points of anxiety and the fear around surgery.
Yeah, that's a big take-home point as patients are going through the postoperative period. When anxiety and fear starts to set in, that's when we really run into issues. Mm-hmm. And they may know something, but they're anxious or afraid, and all of a sudden they doubt what they know, for example, or they worry about a particular symptom being the sign of something really bad going on. How can we help patients through this process, do you think?
I think it is the most helpful thing if they're getting a consistent message. And the point of our collaborative meeting that we do these every Tuesday mornings is to get everybody in the same room to make sure that we're all on the same page when we interact with the patients, to make sure we've got their best interest in mind. So we've got all of our physical therapists, our chiropractors, hospital administration, nursing, everybody that's going to have a touch point with this person, to have a consistent message so that they know when they hear it from multiple sources that really we're all looking out for their best interest.
Mm-hmm. And that Google might not have been.
Right, yeah. Google's actually not a doctor. Yeah, a doctor's a doctor.
It's good to reference things and to do some of your own reading and study, but at the same time, as you go through the process, I think hearing the same message, having a lot of people tell you the same things along the way, can be the foundation for that successful postoperative healing.
Yeah, because while me as a patient, maybe I've never been through this, but my physical therapist has treated 1,000 people that have been through it. So hopefully they've got a good frame of reference to tell me and help me know if I'm on track with where I should be. And then that gives people a little bit of confidence to know that they can keep pushing through.
So you showed a picture of a sandwich in the rounds. Tell us a little bit about that.
Yeah, it's a bacon, lettuce, and tomato sandwich, also commonly known as BLT. In our world, BLT often stands for bend, lift, and twist. Bend, lift, and twist is a little bit antiquated as far as things that you should avoid. We encourage people to move. It was commented in the meeting that it seems a little bit ridiculous, but I think the fear is that if somebody bends, lifts, or twists, that their springs and screws and plates are going to come flying out. And it's just not that way. These are very stable, solid constructs that, apart from a violent traumatic force, it's stable and it's protective on its own. Bending, lifting, and twisting will encourage movement. We want to increase range of motion, increase blood flow to the area, and return to normal function as quickly as we can. And doing that in a safe manner is the best way forward.
Yeah. There's some history in that recommendation. Bending, lifting, and twisting, and no bending, lifting, and twisting is a common recommendation after spine surgery. It has been for many, many years. On the other hand, there's evidence that shows that fear of movement is harmful. And so what we're trying to do here is help patients not be afraid, but more to be mindful of their movements. And when we say don't bend, don't twist, and don't lift anything, I think it promotes a fear of movement, which has maybe been one of the reasons why some of the outcomes from spine surgery have not been as good as we've wanted. On the other hand, being mindful of movements and gradually getting more active has been the approach we've taken.
Yeah, and ultimately, your body knows itself. You will get your own natural feedback. I don't have to tell somebody the day after surgery, you're not allowed to bend over and pick up a 50-pound bag of cement off the floor. I don't need to tell them that because they are naturally not going to want or feel like they're able to do that. Common sense, being mindful of your movements, like you're saying, and paying attention to how you feel is really going to guide you to success.
As patients go through the postoperative recovery process, first of all, they've met with our team, they've met with their physical therapists. You even mentioned talking to patients right before surgery. When you're in the hospital, a physical therapist will work with you in the hospital. When you go home, there's a home health care group, nurse and physical therapists that come to you in your home. And then at the first post-op visit, we're talking to you again and sending you to physical therapy again. One of the reasons we do this is, as you mentioned, these concerns through the process come up again and again and again. And it's the touch points along the way to help patients through the process and keep that encouraging message going. You may have a concern that comes up that you wonder about. You're always welcome to voice your concern or ask us. There's plenty of people to help you through the process. But I find that as we help patients through, we keep their narcotics down, their movement up, their optimism towards healing, that's the scenario through which they can end up with the best overall outcome.
I agree, and ultimately there's a lot of people on their team. Everybody that you're describing, with nurses, the staff here at the office, our surgeons, the home health group, everybody is involved and dedicated and invested into the patient's best outcome. So the most that we can work together for that common goal, I think the better.
Well, you can take some of this into rounds because that's what we're doing next, right?
Yeah, yep.
Go see the patients we operated on. We had a great day in the operating room yesterday.
Yep.
And going to go follow up with a few of them that were admitted to the hospital. It's always fun to see them right after surgery because the stress of having the surgery is now passed and they are on the other side, and usually they feel the difference, and then we're coaching them through the rest of the process. But that's always a fun moment to see them the first day after surgery.
It is, yeah. It's a good milestone to kind of move on to the next now and then start to talk about what's longevity look like. Yeah. Now that we've passed this major milestone, now we get to talk about the next 20, 30, 40 years of life. How do we make you successful in that scenario?
Well, thanks for being at Summit, and thanks for doing rounds. Wonderful job.
Yeah, thank you.